So we talked in a previous video about the diagnosis of arthritis. And so a natural progression then in this video would be to talk about what we do now. What's the treatment for arthritis once you've been diagnosed with that in the foot? So we take a several pronged approach here and in a stepwise fashion. Once we've got the diagnosis of arthritis, what we do is we determine specifically what joint it is in, and we then go from least invasive to most invasive as far as the treatment. So number one, we'll try perhaps an anti-inflammatory topically first. Sometimes patients respond really well to things like Biofreeze or Bengay. There are some different other topicals that can even be prescribed and compounded that can have different medications in them that can penetrate through the skin and do a very good job at decreasing inflammation. After that, if we find that we're not getting enough improvement, we'll even employ perhaps a supportive device like an orthotic. We have done previous videos on orthotics, so please look at those. What these can do is they can help support that joint and prevent the joint from grinding abnormally. And so by supporting that, there can be a lot of pain relief. Many times we'll do the topicals and the supportive devices in conjunction with each other. Then what we'll do, if you've tried all those things already, we'll try an injection. And that is in a combination of anesthetic and steroid. We use a cold spray that kind of shocks the skin from feeling the poke, and we can get into the joint, and depending on which joint it is, some joints in the foot are very small. You can even see how small those joints can be, and even with cartilage in between there, it can also be difficult to find that place where we need to do the injection. The very last thing that we would do is surgery. And so we've tried all these conservative measures. The pain's out of control still, you just can't take anymore, you're crying uncle, or if it's keeping you from doing what you want to do, wearing the kinds of shoes you need to wear as well, then that can make it necessary essentially for us to go in and surgically help that joint. And it could be a combination of removing spurring from the area, perhaps replacing some cartilage with an alternate type of surface. In the worst case scenario, if that joint is completely trashed, if there's nothing left in that joint, then we may have to do a fusion of the joint. So instead of having motion across that, we end up with a combination of screws and maybe plate to help to prevent that motion across the joint and fuse the joint. Either way, it's usually 3 to 4 days with the foot elevated above the heart after that incision has been closed with suture. Once that incision is in the process of healing, we take the stitches out after a week and a half. And then, depending on how aggressive a procedure we have to do and how things look on x-rays, you may need to be off of your foot from anywhere from 2 to 6 weeks, depending on how things, what exactly the procedure was. So that's just a brief analysis and discussion of what treatment for arthritis would entail. There are always new things coming out as well, different kinds of injections, for instance, that have different properties that can help with that or prevent that grinding and help the joint to. And it's a kind of exciting time. There's a lot of technology that have allowed patients to go longer without having surgery. So come on in and we can evaluate you, and look forward to seeing you.